Back in medical school during my clinical rotation in obstetrics and gynecology, one day by the bedside, my professor handpicked me to perform a vaginal exam, and as a then young, naive, enthusiastic me, I quickly donned a pair of disposable gloves, went to the patient, patted their legs, but before I could insert my finger into anything, my professor called me and was like, "Gentleman, what do you think you are doing?" Okay, so I look at my professor and it was like he was the one who didn't know what he was about. The next question he asked was, "Are you only interested in the introitus?" Okay, I looked at him again. This time I was thinking, what else should I be interested in? You literally asked me to perform a vaginal examination.
You said what?
Scratch that. That brings us to the lesson for today. See, as a candidate in obstetrics and gynecology, whether you are a resident or you are a medical student, at some point it will be required of you to perform a procedure or demonstrate your knowledge about the performance of a procedure. It could be at a practical station, it could be in a viva interaction, it could be a picture test, or it could even be a written for you to demonstrate your knowledge in performing the procedure. As a student, you shouldn't be caught in the temptation of going straight to demonstrate the procedure itself or going straight to write in detail what the procedure is about. You must always remember that a procedure performance has three aspects. The structure is that there is a pre-procedure, the procedure itself, and the post-procedure. That means if you limit yourself to only performance of the procedure, you will miss very, very important marks in the pre-procedure aspect and the post-procedure aspect. So as a student preparing for my membership examination, I developed a mnemonic myself, and this mnemonic ensured that I checked all the boxes, whether pre-procedure, the procedure itself, or the post-procedure during performance of a procedure, and for that matter, I scored all the marks. I want to believe I scored all the marks. Yes, I want to believe so. Now this mnemonic is as simple as it is. Rapper Pimed, thank you, doc. Rapper Pimed, thank you, doc. You see, the first R stands for establishing rapport and review of equipment. So rapport and review of equipment. In rapport, you are expected to introduce yourself to the patient, identify the patient by name, age, and the procedure that you are going to do. You're also expected to let the patient know what the procedure will involve. And at the end of it, you must ensure that you have obtained an informed consent. This could be written or verbal. By and large, for procedures by the bedside, a verbal consent will suffice. But if you have to do the procedure in the theater, then you need a written consent. Also, in this rapport process, you must make sure that you do it in the presence of a chaperone, and also that you ensure the privacy of the patient and the patient is what screened. Then for the review of equipment, you must know the procedure you are going to do and the equipment that will be needed to carry it out. And this includes also ensuring that the equipment do function. So if it's a written, you have to state that I'll need so and so equipment, and I'll make sure that they are functioning. If it's at a practical station where you are demonstrating, you must actually be seen testing for functionality of the equipment, and that is done. The A, or the first A, stands for anesthesia. In many procedures, you are going to cause some form of tissue damage, and this will lead to pain. For that matter, you must provide anesthesia for the patient. It could be local anesthesia, it could be a regional anesthesia, it could be a general anesthesia. Then the P stands for positioning. Of course, you may need to position the patient in a way that makes the procedure easy for you and comfortable for the patient. For that matter, for example, in a procedure like performing an episiotomy, the patient will actually be in the lithotomy position, whereas in cesarean section, the patient will be supine. I must also be quick to add that the P and the A can be interchangeable. What I mean is that in a patient that you are going to carry an episiotomy on, definitely you position a patient before giving anesthesia. Whereas in a patient that you are going to carry cesarean section on, if you are going to do a regional anesthesia, then you definitely have to give the anesthesia before positioning the patient. The next A stands for asepsis, and this is something that we do not joke with in obstetrics or gynecology. The last thing you want to do is to transmit infection to the patient or give the patient an nosocomial infection. So whatever you are going to do to ensure that you minimize this risk, you have to. If it has to do with you washing your hands with soap and water and scrubbing completely, you have to stay so. If it has to do with you washing your hands with some alcohol, you have to stay so. If it has to do with actually providing the patient with prophylactic antibiotics, then you have to do so. So whatever you need to ensure that this patient or the procedure that you are carrying out is under aseptic condition must be stated, and it's very important. Then the P now, the next P now stands for performing the procedure. So you realize that even before performing the procedure, we've gone through establishing rapport, review of equipment, anesthesia, position the patient, and asepsis. If you went straight ahead to describe the procedure in detail or demonstrate it in detail, then you would have missed all these marks up there. There are 1001 procedures that we perform in obstetrics and gynecology. This is the wrong video to talk about all of them. In fact, I can't. What I'll do is that in my next video, actually, I'll describe performing an assisted breech delivery, and I'll use that to demonstrate how effective this mnemonic is. So that goes for performing the procedure. Whatever procedure that you are going to perform, you must know it in detail and step by step what it entails. So now after performing the procedure, then there are other things you need to do to ensure that you do not miss marks or you tick all the boxes. The first is to inform the patient. What do you inform the patient about? Inform the patient on the success or not of the procedure. Also, your findings, what you found during the procedure, and then also whether or not there were some complications. This the patient must know. Then the M stands for medications. Definitely based on what you did, especially if the procedure that you carried out involves so much tissue damage that the patient will be in pain afterwards. Then you need to provide the patient with analgesics. If it also requires that you continue antibiotics, you have to give the patient antibiotics. So that will be dependent on the procedure that you carried out. The next is E. Now this E stands for education. This education is different from the initial I. In informing the patient, we said that you tell her whether or not the procedure was successful, what you found, and also whether or not there were complications. In this E, you are actually telling the patient what he or she needs to know going forward, and this may even include prognosis. However, in any procedure, what you shouldn't forget in your education, especially in obstetrics and gynecology, is educating the patient on sex and contraception. This is very important. The patient must know when she can resume sexual activity. For example, if you carried out an episiotomy on a patient, the patient can resume sex when there's complete healing and when she's comfortable to do so. Generally, it is better if conception is delayed for about 18 to 24 months. And this will mean providing the patient with some form of contraception. So the R then stands for review. So what you do is that you give the patient a review date. This review date, whether or not she's supposed to return 1 week time to 2 weeks time or a month's time, you have to let the patient know. If you don't state it, you are going to miss marks for that. The D stands for disposal of equipment and materials that you use. And of course, if these equipment are reusable, then you have to dispose of them in a 0.5% chlorine solution for initial disinfection and later sterilization. If they are not reusable and they are infectious, you deposit them in infectious waste bin. If they are general waste, you dispose of them in a general waste bin. Also remember that I to D, that is informing the patient to disposing of the materials, can actually be done in the procedure room by the patient's bedside. You don't need to carry the patient to your desk or back to the consulting room to give the patient this information or let the patient know this or dispose of the equipment. You can do it in the procedure room. Then now when you are done, you have to thank the patient. So you thank the patient. In fact, you can even carry the patient to your desk or to the consulting room to thank the patient. And the doc there stands for documentation, not you, the doctor. This brings us to the end of this presentation. No, that's not the end. You see, I have another story to tell you. Back in medical school, again, my professor asked one of my colleagues to perform a procedure. Now, this colleague of mine was coming from one of the schools in Kumasi. I think it was Prempeh College or Opokuwa. It's one of them. After performing the procedure itself, he demonstrated dexterity in performing it. And when he got to the point where he had to educate the patient, he was like, I will educate the patient and counsel her on sex and contraception. Okay, my professor was like, what did you say again? He repeated himself, I will educate the patient and counsel her on sex and contraception. So the consultant was like, don't worry, you can even delete her from the hard drive. This friend of mine did not get the sarcasm. He went like, oh, say, I don't even have a computer. Look, if you didn't get the joke or you didn't find it funny, don't blame me. It's not my fault. Blame your sense of humor. See you in the next lesson.